So can the heart rupture after a heart attack? And yes, it can. Some of the commenters at my YouTube, which by the way is called Knife After Death, were dismayed at this revelation that the heart can rupture during a heart attack. Well, let me explain how that happens. So first of all, a heart attack or a myocardial infarction is due to decreased blood flow through the coronary arteries to sections of the heart muscle. When that happens for a long enough period of time, the heart muscle dies. That's called necrosis. And as that area of necrosis expands in the heart, the architecture that holds that heart together, that holds it into place where you can pump blood normally, that wall starts to break down, because as the heart beats, there's still the normal pressure that's in the heart from the atria to the ventricles and from the ventricles to the great vessels. And so what happens is that pressure exerted on that dying wall that no longer has that good architecture to hold it together, it will rupture, it will burst, and the blood will start to leak out. And that's a big problem, because what happens is the blood leaks out into the pericardial sac, but there's no way for that blood to get out of the pericardial sac. So what happens? The pressure increases on the heart. As the blood exits the heart and enters the pericardial space, it causes what's called a cardiac tamponade, which squeezes the heart and can cause, obviously can cause death, because I see it a lot. But physiologically, your blood pressure is going to keep dropping because your heart's not going to beat effectively. And when you get to this point of a myocardial infarction, it's very difficult to survive. You have to have a pericardiocentesis to pull that blood out, but also you're going to have ICU care to hopefully survive that heart attack. As a forensic pathologist, I see this many times a year, where it's a person who is found deceased at home. You talk to the family and they say, well, yeah, he thought he had heartburn for 3 or 4 days and he was taking antacids, or he had pain that radiated to the center of the back, or he had pain in his jaw. And what was happening is that person was having a myocardial infarction for 3 or 4 days, and the amount of time it takes for that wall to rupture, people argue over it. I usually say 3 to 4 days to somewhere around 7 days. Some people will say 10, and I've had forensic pathologists arguing with me in my comments about the exact date. There is no exact date. There are a lot of factors that go in there, but it's usually not after a day or two, and it's usually not after 2 weeks. It's usually sometime in that 3 to 10 days or so. So yes, myocardial rupture causing cardiac tamponade is a very interesting. I'd like to show you what it looks like here, but unfortunately, TikTok won't let me do that. But I might show it at my Substack, which is called Dr. Darren Wolfe, if you want to go over and subscribe to that, because they don't censor anything I put up over there.